I'd like it if you could tell us a little bit about what a nurse's role is in promoting and using complementary and alternative medicine. In particular, how can we begin to integrate these trends into our practice as beginning nurses?
Okay, well, first of all, the interest is there, so I'm really glad about that. I think as beginning level nurses, your primary role is going to be focused in on assessment, so that you're really at the patient's bedside or out there in the community with the patients. So I think you have a very, very important role, and that is assessing, basically who's using what, and if they're doing it safely, and if they're doing it effectively. We do know from the data that a lot of people use different kinds of things basically because their friends or their neighbors down the street told them that it was a good thing to use. And sometimes they have not even studied up on what the product is, they just decide to buy it and use it. The key thing is for nurses to assess and then also teach their patients. Part of it also, I think, with the nurse's role is to be careful with judgments, so that you're aware of your biases that might be different than what someone is using, that might be culturally determined as well. So to do some reading up on these different therapies and to be aware. I don't think that beginning level nurses can necessarily jump right into using these kinds of therapies without some study. Whether you study a level 1 healing touch class or Reiki class, then you could start incorporating them into your practice because you will have gotten some level of credentialing and education. But I think doing an assessment, doing an integrated assessment, so that, and some of these are going to be published shortly, so that you know what patients are using, can guide you in the right way. Some of the herbs, for example, can be not too good before surgery, for bleeding levels, these types of things. And this is where you could hopefully prevent any adverse problems.
And can you also touch on, since you mentioned credentialing of nurses to provide some of these therapies, can you talk about the certification that's available from the American Holistic Nurses Association?
Sure. Well, the American Holistic Nurses Association has, not through them, but it's associated with them, a credentialing board. And so that if you're interested in providing holistic therapies, and those of us who have studied can do that, and the certification allows you to go a level with doing that, you would basically go to the American Holistic Nursing Association's website, check into the holistic nursing credentialing. As a baccalaureate nurse, you can sit for, if you meet the requirements and pass the exams, for to be an HNC, Holistic Nurse Certified. Once you get your master's, you can go for AHN, it's HN, BC, which is what I am, so that's Advanced Practice Holistic Nurse Board Certified. And so they credential you, similar to what the American Nurses Credentialing Center does as well for other credentials. Is that kind of clear? Yeah, good.
Yeah.
Okay.
All right. Thank you very much for answering
You're
our
welcome.
questions.
Thank you for your interest.
Thank you.